I was actually born in Colombia. I moved here when I was a kid, so I'm a bilingual provider. And I did my medical school at UCSF in San Francisco, my residency in physical medicine and rehabilitation at Stanford. And I did a fellowship in interventional spine, sports, and regenerative medicine up in Napa. My interests have always been musculoskeletal medicine, neuropathic medicine, and pain management. And I get to do that on a daily basis. So I do the diagnosis and treatment of any musculoskeletal and spine disorder. For diagnostics, I use ultrasound, MRI, obviously exam history, and as far as treatment, I do basically any kind of injection manageable. From corticosteroid to prolotherapy to regenerative medicine, including PRP and bone marrow stem cell treatments. I use ultrasound guidance for most of my injections. I also do fluoroscopy-guided injections for the spine. And for anatomical locations, anything head to toe that could benefit from any kind of inflammation and pain control or regeneration, I will target. So there is a whole process that I find I can be very helpful with, from the diagnosis all the way through the treatment, and seeing the progression of improvement when treatment is started using our multidisciplinary environment is very rewarding to see the patient's knowledge increasing of their condition, as well as the treatment that they receive from all of our providers and from me, with the end goal of them being significantly improved and back to their regular function and their regular life. So a good number of my patients are Spanish speaking, and that's actually one of the reasons why I went into medicine in the first place, being a native Spanish speaker and immigrant to this country, is that I actually get to provide service in the patient's native language. And it's obviously a huge benefit to be able to connect with patients in that regard, and something that makes me enjoy what I do every day even more. Not only to be able to improve the pain and disorders that the patients might have, but also be able to do so with that extra level of comfort and accuracy for the patient, being able to speak in that same language and have a common cultural connection as well.